Good evening, everyone. So, fall prevention is an expansive topic, but it is a topic that affects. Oh, there we go. It is a topic that affects us all at some point or other. So, falls are the second most prevalent cause of accidental injury and death globally. We have almost 650,000 people a year die from accidental falls. So preventing them is a very, very important matter. So falls, even if they're not fatal, can result in long-term treatment being required. And from there, it's usually a spiral that might be quick or might not be so quick, but it's usually a downward spiral in terms of quality of life and health. So prevention is definitely better than cure in this case, all right? So there are several risk factors: age, medical conditions, but also side effects from medications. If you're taking pain medication, for example, or treatments such as blood thinners, this can affect your blood pressure. This can affect you and give you vertigo. In those cases, you would be at higher risk for falling. Poor vision and reduced mobility are also two other factors that are huge when it comes to these problems. So if you have failing eyesight or you are not so mobile anymore, you are at increased risk for falling as well. And the last but not least is unsafe environments. So we're going to focus on unsafe environments today, and we're going to look at how we can improve things at home. So the first thing we look at is medication review. So some medications can interact with other medications that you're taking. And so you need to consult your doctor on this. You cannot just add supplements or medications without actually checking first, all right? We would also be looking at treatment of low blood pressure, which is a cause of vertigo, for example, when standing up, when climbing stairs, when going down. We would also be looking at treatment of correctable vision impairment and muscle strengthening. But I'm going to talk about home assessment and environmental modification. So this is to reduce the risk of falling, reduce the severity of falls if they do happen, and also to increase familiarity and predictability of the home environment. So this is a common one. When elderly people are in the bathroom, we frequently hear stories about elderly people falling and breaking their hip, for example. So a bathroom is usually a place where elderly people are unsupervised. We have no direct line of sight. We don't know what's going on when they are in the shower, when they are on the toilet. It's full of hard surfaces. It's got slippery floors when wet. And so what we want to do is we want to make sure that if somebody is at a risk of falling, perhaps they have a history of falling already, we want to make sure that the door is closed perhaps, but not locked. Because if they do need assistance, you don't want to have to break the door down. That just adds delay and can cause further injury. We also want to avoid slippers or other inappropriate footwear in the bathroom, as this can result in a slip and a fall, all right? Around the house, carpets and rugs can be a huge cause of accidental falls. So small carpets, for example, at the doorway, outside the bathroom, in the kitchen, at the sink, if they're not installed properly with non-slip backing, can be a source of accidental falls. As people are walking and they kick on them, the carpet will come up and get between their legs, and they can slip and fall in that instance as well. Larger carpets also have issues. The edges of these carpets tend to turn upward over time, and we want to make sure that we stick them down with double-sided tape to prevent any injuries from happening there as well. Stairs. This is another common problem area. We want to make sure that there is a railing on both sides of the staircase, all right? So whether they're going up, whether they're going down, whichever arm is their preferred arm to support themselves, they will be able to support themselves properly. We want to make sure that bright lighting is available overhead, not at a weird angle from the side where it casts long shadows and obscures vision of steps. And if there's carpets on the stairs, we want to make sure it's firmly installed. And last but not least, make sure that there are no objects on the staircase itself. Some people like to put decorations, picture frames, they like to hang things from the sides. These are all contributing factors to falls and trips. Furniture arrangement. So in the living room, we want to make sure from the doorway to perhaps the sofa or the elderly person's favorite chair, there is a direct, clear path, unobscured with carpets, rugs, wires, and other things like that. We want to make sure that any excess cables are coiled up and they are clipped together or they are taped to the floor or the wall. Because it might be all right today, but at some point when we are cleaning the house or when someone trips over them, they might move out of place and again cause a trip and a fall. We want to be careful and aware of our arrangement of furniture. Let's not turn the living room into an obstacle course. So if the elderly person walks into the living room, for example, and they have to walk around tables or counters or a chest of drawers to get to their chair, that just increases the chance that while they are moving about, they might fall, they might lose their balance, they might bang into something. So if we do this, then we can reduce any chance of this happening. We want to make sure that the gap between furniture is adequate as well. So if you have a coffee table and a sofa, you want to make sure it's not a narrow gap. You want to make sure that there's enough space for the elderly person to walk properly rather than having to turn to their side and sidle through such, And we're going to be doing 2 demos after this. We're going to be talking about how to transfer a patient from a wheelchair to a chair or vice versa. And we're also going to be talking about how to assist someone up and down the stairs. All right? So maybe we can switch to the demo and have the camera focus. Lata? I'm going to have my 2 assistants here, my colleague and our volunteer. Thank you so much. All right? So the first thing that Lata here is going to show us is how to properly transfer someone from a chair to a wheelchair or wheelchair to a chair. All right? So we're going to have him sit down first. Okay. So I'm aware we already had a demo earlier about this, but we're going to be focusing on preventing falls during the process of transfer and also how to prevent injury to the caregiver. Because frequently what happens is the caregiver lifts or positions themselves in the wrong posture and they cause themselves injuries and then that results in a fall. Okay? So Lata, if you go ahead. Yes. All right. So the first step would be to position your leg between the patient's leg. All right? And the other leg outside at an angle. All right? The chair will, of course, be at a reasonable 45-degree angle to the wheelchair. You will then encourage the patient to put his arms on your shoulders or around your neck, and you put your arms around their waist. All right? And then you would want to lift. And it's important to lift with bended knees. So you lift with your knees, not your back. Yes. And then you pivot, and you quickly and gently place the patient down. All right? So we're going to do our next demo. All right? And this time we're going to do a stair demo. So it's actually funny because at this event itself, we've had a number of people, when they're coming up on stage, trip on this last step. So it's the perfect demonstration. So if you guys, all right. So Lata is going to assist our volunteer here down the stairs. And it's important, okay? It's important when supporting someone up and down the stairs to support them at all times. A lot of people, when they're helping an elderly person up and down the stairs, they kind of stand around and hover around them, but they don't quite support them. You know, they're like, in case you need help, I will support you. But that's not the right approach. The right approach is to constantly offer support. So, Lata, if you could demonstrate. So her arm is around his back to prevent him falling backwards. And his arm is around her shoulder to prevent him falling forwards. Yes. So if there is a railing, which there should be, our volunteer here would put his arm on the railing and support himself on that side. And they're now going to go up the stairs 1 step at a time. Okay? Slowly, 1 step. Next step. He's a bit eager here. All right? And could we have that going downwards now? All right? How do you assist someone going down the stairs? All right? All right, same thing. Arm around her shoulder, her arm around his waist, one step at a time. Don't rush, don't hurry. All right? So, thank you very much, ladies and gentlemen. Do you have any questions? No questions? Ah.
It's just a comment. It's not that we are hovering behind the person. It's just that they don't want to be assisted.
That's a very good point, and I've experienced that myself. But sometimes when there is a falling risk, we might need to sit them down and explain that, we just can't take the risk, because it really is better to, be a bit, too protective in this situation rather than let something happen first. So that might be something you need to talk about with the person, and get them to agree to it. All right?
Hello, my name is Kamal. Yes. Okay, with reference to falls, what if, let's say, because my mother, she has Alzheimer, and she's tend to be very independent. And certain things, when we want to support her, she tend to resist. She has the mindset that she can do everything on her own. So now she's very fragile. She walks with a tripod walking stick. Because of her, I would tend to use the word stubbornness. She tend to be very independent, but it worries us. So whenever we want to support her, then she will tend to resist, So how do, as a caregiver, how do we overcome a person who needs support from falls, but has Alzheimer, thinking that she's still strong? So how do counter this scenario? Thank you.
So typically in these scenarios, especially when you're dealing with someone who has dementia or Alzheimer's, there's not a lot you can do to change the current mindset that they are in. And it does change from minute to minute, hour to hour, day to day even. So these cases typically take a lot more patience and possibly more than one person working together at the same time to assist the person. Anything to add? No, okay. Yeah, but there's no special technique that you can use in this case. It really will just take more patience and more effort to get it done. And like I said, possibly more than one person will be required to assist.
My question is, your presentation says no slippers in the bathrooms. However, I use non-slip slippers because I feel that they are better than barefoot because of the soapy water. Otherwise, do you have other recommendations for bathrooms? Because they're the most slippery, and most people really fall in bathrooms.
So I would still say no slippers. If you really do feel the need for footwear, I would recommend shoes of some sort, because shoes don't easily come off the foot and cause them to trip. So when you're wearing slippers, the edge of the slipper can get caught on something, and the slipper can very quickly come out of alignment, and then they will fall because of that. And the slipper itself, it's not very secured to the foot. So something like a sandal, where there are straps around the ankle, behind the foot, behind the heel, that would be a better suggestion than slippers. Slippers are just not secure enough. They can very easily come off.
They have such a thing called bathroom slippers, and they don't have a strap, but I feel that they're really very good. I've been using it for years.
Okay.
Because what I mean is, they have holes underneath.
For drainage.
I don't know whether, I think it's quite common. It's called non-slip bathroom slippers.
Yeah, some sort of specialized slipper, I guess, is definitely better than your normal pair of bathroom slippers, for sure.
For falls in elderly people who are still mobile, what would be your advice on the mode of protection? Because a lot of elderly people, they actually fall with outstretched. That's their first mechanism. And that tends to result in a lot of wrist fractures. So how can you advise what's the first thing that they can do to actually prevent this when they fall?
So the risk mitigation in this case is pretty much exactly the same, in the sense that we want to prevent them from falling at all. So regardless of how they fall or how they break their fall, or where they are hit on their body, it usually has the same result. They are injured, sometimes injured very badly, sometimes they break their bones. So overall, as the elderly person is aging and they start to show signs of being less than steady on their feet, we as caregivers will need to really step in and watch and supervise, so to speak, their activities, right? And we'll need to, I guess, chaperone them when we feel that there are risks. So whereas someone was able to, just walk down the street previously around the neighborhood, as they age, we might need to start accompanying them for these things. If we are not there, we just cannot stop it from happening. And if it does happen, there's nothing that can really make it better. If you tell an elderly person who is still mobile that they have to use a walker, they're not going to do so. So we need to really be present and ever watchful to prevent it from actually, prevent them from actually falling.
There's a question here.
How do you manage, how does the caregiver manage the elderly when the elderly is much bigger size than you? Like for men who are big size and or frame, they are much more robust, and here I am skinny.
So I was actually discussing that with my colleague earlier. I said to her, this is going to be a question, and we were talking about it. And so the general rule of thumb is, if the person weighs more than you, and you're not able to handle it, then you just need the help of a second person. And there's really no getting around this, because you can't violate the laws of physics. Sorry? Oh, okay. So you really do need more than one person. If the person you're taking care of is just extremely large or much bigger than yourself, then you do need assistance. And there's really no way around this that we found.
That means I need to do a lot of strength training and muscle building.
That too. Thank you.
There's one question over here.
Just to recap, you were saying you get an assistant. I have a mom who was so stubborn, refused help, refused any maid, refused anyone except me. And she is much bigger than me. So in other words, actually we are strengthening ourselves at the same time, because it's so, when you demonstrate, it's so easy because the person is not a dead weight. Yes. Whereas the person that I'm caring for is a dead weight, and she's heavier than me, so it's a dead weight. It's very bad.
Yes, it is. So in cases where we have elderly people who not very keen on having somebody else being their assistant. In some cases, like even in my own family, we've had this situation, stubborn grandparents. But what we ended up doing was, you sort of posture this assistant as your assistant, not so much their assistant. They are here to help me take care of you. But yeah. All right, I think we are out of questions. Thank you very much, ladies and gentlemen.